President and Congress, Bronwen Handyside from Unite in support of Composite 14. In the trade union movement and now in the Labor Party, we work for a world which is for the many and not the few. Margaret Thatcher famously told us that there was no such thing as society, and she set out to create a world in which this was true. One of her projects was the creation of the purchaser-provider split in the NHS. It was the thin end of a wedge which has succeeded in shattering the NHS into suitably sized and structured pieces ready for the private sector to take over. This is happening while we witness the development of an inequality-fuelled social and health crisis. Life expectancy is decreasing for the poor and increasing for the rich, while infant mortality is on the rise in deprived communities and falling for the wealthy. Secrecy and lack of consultation have surrounded the undemocratic imposition of the sustainability and transformation partnerships which Unite is campaigning against. They've been dressed up as wonderful ways for health and social care services to collaborate locally, but trades unionists will recognise that management speak word transformation, which actually means cuts, in this case £22 billion worth. And speaking of secrecy, how many know that these 44 STPs are planned to evolve into yet another structure, accountable care organisations based on a US model which are designed from the outset to partner with the private sector? 8 already exist and several have already announced the inclusion of private companies. The commercial interests which have lobbied British governments for the last 30 years are achieving their aim of occupying the NHS and sucking out profit at the expense of patients. It looks like Thatcher's project to reverse the gains of the welfare state and transfer public funding and assets to the private sector is nearing completion. The composite refers to working with campaigns, and this must include the pensioners movement and organisations such as the National Pensioners Convention, which campaigns tirelessly for the NHS and social care to be adequately funded from taxation and provided free at the point of need. But the best hope for the NHS and social care is for the trade unions as a whole to ramp up the battles against austerity, to break this current smoke and mirrors Tory government, and for us to start campaigning now for a Labor election victory.